Welcome to Olympian Water Testing, giving you the best in water analysis. Today we're looking at the timeline for community water fluoridation. How did it all get started? What is the history behind it? We're going to take a look right here on the CDC's website. So in 1912, the Marine Hospital Service, formerly dedicated to caring for ill and disabled mariners, becomes responsible for improving the health of the general population, is renamed as the U.S. Public Health Service, USPHS, which later includes the National Institute of Health, the NIH, and the Center for Disease Control and Prevention. In 1914, U.S. drinking water standards are enacted. Even though the federal standards only apply to interstate carriers, mainly railways, many state regulators adopt them too. Then, in 1901, dentists in the United States and Italy separately observe lower rates of dental decay in populations with distinctive stained teeth. Dr. Frederick S.K. of Colorado Springs notes that many residents have what locals call Colorado brown stain, devotes his career to investigating the phenomenon he labels mottled enamel. In 1916, the first of McKay's and Black papers were released as a paradox at the heart of their investigation. Contrary to what might be expected, mottling does not seem to increase the susceptibility of the teeth to decay. A dentist in Essex, England, determines that children living where mottled enamel is common in the UK tends to have much less dental decay than other children. Meanwhile, McKay convinces the residents of Ohio town, where the mottling is widespread, to spend $35,000 to switch to a new water supply. In 1915, G.V. Black, dean of Northwestern University Dental School, joins Kay in Colorado to study dental mottling. McKay grows more and more, and certain of something in drinking water is the cause. However, the analysis of water samples from the stricken communities in a half-dozen states reveal nothing out of the ordinary. Kay and Black's collaboration spans decades, as they jointly publish 5 seminal papers on dental mottling. Now, McKay's learning of the situation. When bauxite requests water samples from the town's wells, McKay's analysis again proves inconclusive. And throughout the 1920s, Dr. Robertson of Bucks, Arkansas, observed an unusual number of cases of mottled enamel among children born after 1909, when the community began drawing water from a new well. Aluminum in the abundant bauxite for one of the town is named wrongly, causing the mottling in the well to be abandoned. And also Churchill, a chemist of the Aluminum Company of America, now Alcoa, which owns a ton of bauxite in its mines, uses technology to analyze the water from abandoned wells and finds a key concentration of fluoride many times higher than normal. Then McKay sends the water to Churchill for analysis and finds that McKay's samples also have extremely high concentrations of fluoride. McKay runs to Oakley, Ohio, which switched to a new water supply urging in 1925, and he finds that the children born since then have no dental mottling. Dean publishes the detailed criteria for diagnosis for dental fluorosis and declares fluorosis an acute and urgent public health problem. Then we also have Dr. Trenley Dean, officer and founder of the Dental Hygiene Unit at the established NIH, determines the mottled enamel is caused by too much fluoride intake and names the condition dental fluorosis. Then conducts the people who drink the water with fluoride concentration of 1 parts per million have lower or extremely low risk of developing even cosmetic fluorosis. They also analyzed the data collected of fluorosis and dental decay among 26 children. General Cox and a team of scientists from Mellon Institute at the University of Pittsburgh publish a paper proposing controlled addition of fluoride adding to drinking water, and we can see the Grand Rapids City Commission votes to approve the pilot fluoridation project, and that's how it happened. In Grand Rapids, Michigan becomes the first city to fluoridate when engineers at Monroe Avenue Water Filtration Plant begin adding a carefully controlled amount of sodium fluoride to the city's water supply at 4 p.m. And then we can see the rest is history as it keeps going on. That's how the history of it got started. And I think this is very interesting to see how water fluoridation got started based off of these analyzing observations from different doctors. That being said, it's always a good idea to periodically test your water to make sure that there's not an extremely high level of fluoride in it.